question, the member from Kenora-Rainy River.
Thank you, Speaker. My question is to the Premier. Hydro bills have gone up 300% under this Liberal government, and families across Northwestern Ontario are paying the price for decades of hydro privatization under this government and under the Conservatives before them. Now we've learned that Dryden Regional Hospital's hydro bills have increased by a staggering 44% in just 5 years. Wow. The hospital is doing everything that it can to conserve energy. They've made significant investments in retrofits, yet their bills continue to soar. Why is this Premier letting down the people of Northwestern Ontario and forcing our hospitals to take money out of frontline care just to cover up their soaring hydro bills? Minister of Energy.
Minister of Energy.
Thank you, Mr. Speaker. We've actually worked hard with Hydro One, which is in that area, Mr. Speaker, to reduce bills for all residential customers between 40% and 50%, Mr. Speaker. When I was in Atikokan early on, Mr. Speaker, that agency, that entity said that the bills in that community have been reduced between 34% and 40%, Mr. Speaker. So we're going to continue to work with these type of companies to bring forward this type of relief, Mr. Speaker. When it comes to hospitals, they have also been utilizing many of the programs that we have put in place, working with their LDCs, and have seen significant savings, Mr. Speaker, that they are now able to then put back into care. And many of these hospitals, Mr. Speaker, are talking about the impact that the electricity has on their overall costs, Mr. Speaker, is only 1%, Mr. Speaker. So we've got programs in place that will continue to help these institutions and the residents of the province.
Thank you. Supplementary.
Northern hospitals and northern families need a Premier who cares about making life more affordable and stopping the cuts to our frontline health care. But this Premier keeps letting Northwestern Ontario down. Dryden Regional Hospital is suffering from sky-high hydro costs because of the privatization of our hydro system by Liberals and Conservatives alike. Our hospital is not getting the relief that it needs. So they've come up with a capital plan that would allow the hospital to go off the grid. Yet this government refuses to deliver the funding they need to implement that plan. Why is this Premier delivering one disappointment after another to the people who need health care and who also need to be able to pay their hydro bills all across Northwestern Ontario?
Thank you, Minister.
Again, Mr. Speaker, since coming into office, we've increased hospital funding by 54%, allowing us to treat more patients and provide better care and reduce wait times to some of the shortest in the country, Mr. Speaker. The reality is that hospitals send 1.6% on average of their total operating budgets on hydro. And also, Mr. Speaker, we just invested $50 million in over 100 hospitals to make sure that they can help them retrofit, Mr. Speaker, to even reduce their bills even more, Mr. Speaker. That means that well over 90% of the hospital budgets go towards the rest, Mr. Speaker, hiring nurses and doctors, keeping wait times low, and ensuring patients have access to the high-quality services that they need, Mr. Speaker. When it comes to action, when it comes to making sure that we're helping hospitals, we're helping individuals, we're helping families right across this province, we're doing it with health care, and we're doing the same with electricity, Mr. Speaker.